Well, thank you for the kind introduction. My name is Dia Liu. My voice is not very clear and loud today, so I'm sorry for that. If you look at the booklet, you will see many number of the slide for this presentation. So you can find some details in the booklet. So I will just briefly discuss the topic during the presentation. Usually I speak quite fast, so I try to slow down. So I will try. So I researched on the miscarriage and stillbirth and fetal malformation in the workplace. So this is the agenda that I'd like to share for this presentation. So I will talk about the current status and the Korea's legal system. And then I will also focus on the actual practices or the cases, which is the number 3 here. So as a background, as you know, now we do not have a lot of births. The number of babies is decreasing, and that is natural for the number of miscarriages and the stillbirths also decrease. However, when it comes to the proportion of the wage and salary workers in the total cases of the miscarriages and the stillbirths is increasing. Although there are not many applications for the recognition of occupational incidents in relation to the miscarriages and the stillbirths, it's not that how many, but still there are some cases where that was recognized and approved under the recent law in Korea. So if you think about the miscarriage and the stillbirth at work, there are many work-related risk factors for the pregnant woman at work: physical, biological, and the chemical hazardous factors. And you can see many different factors for each category. I don't believe that this is quite different from one country to another. For the related researches, in 2013, there was a research which looked at the negative outcome of the pregnancy is more witnessed for the working woman compared to the non-working woman. And by industry or by trade, the public health and social welfare and sales retail, the professionals and the science technology industries saw higher number of the miscarriages than the stillbirth. And also, the women workers have a higher probability of experiencing premature miscarriage compared to the non-working women. For workplace in Korea, the semiconductor industry has been studied more intensively than others. In 2015 research, there was a research on the electronics manufacturing site. They experience more probability of experiencing the miscarriages and the menstrual abnormalities. And there was also a studied at the men who are working for the semiconductor industry. The workers in the semiconductor industry experience a more probability of the miscarriage and the stillbirth. And if their spouses are also working in the semiconductor process, then that hazard ratio increases. And there was another research which looked at the miscarriage risk factor depending on the industry, and showed that among the industries with the female workers, the miscarriage risk was highest in the air transport and followed by the rubber and plastic manufacturing. And there was another study which analyzed the national health claim data. If you look at here, the yellow box or the orange box shows the miscarriage plus stillbirth. So in the recent 5 years, that has been increased. And if you look at the employer subscribers, the female employer subscribers of the national health insurance system, then they occupy more than the 50% of the total miscarriage and the stillbirth. And in this study, the Korea Workers' Compensation and Welfare Service data was used, especially the determination of the occupational disease data was used. So if you look at the table, there were only 22 applications for the occupational disease approval, and there were only 10 cases approved and 12 was rejected. 6 to 9 in this table occurred from the same company, the same hospital. This is applied by the nurse. And that is very important cases because that were related to the recognition of the industrial accident of the fetus later on. So if you look at the reasons for the application, it includes misabortion, premature rupture of the membrane, and intrauterine death of the fetus. And as for the reasons for the incidence, is the stress from the harassment, anxiety, and nervousness during the employment, and also the overwork stress and long-term irregular shift work and others. For the unapproved cases, there were the cases such as a history of the pre-existing miscarriage or work-related result that cannot be objectively confirmed or infection. These were the reasons behind the disapproval. And if there is not sufficient ground and justification in terms of the medical reason, then that cases were not approved. In more recent years, the information is provided more to the judiciaries here. So other than just work-related risk factors, but also there has been some work adjustment for maternity protection, or if there is a worker's request, whether those requests were accepted or not, these informations were also shared. And for the approved cases, it's quite interesting that there are more women judges in the determination board. And out of 10 approval cases, 9 of them involve personal service workers like the nurses or the social workers and others. Even though those workers are pregnant, it is not easy for them to stop providing the services when they are involved in the care for the patients or the children. So when it comes to the law, you can see there are maternity protection law in Korea, which are related to the Labor Standard Act, Equal Employment Opportunity Act, and Employment Insurance Act. If you go to the cases that I want to share, I first talk about the nurse case. We call the law as a recognition of the industrial incident of fetus, but I should say that there is no law specific per se. But we call this kind of a cases as a industrial accident of the fetus, and that's why the relevant law utilized this kind of a term. So there was 15 nurses and 5 nurses suffered miscarriage, and 10 suffered from the congenital deformation of their children. So there was an investigation conducted, and in 2012, the occupational disease was recognized, but the medical care benefit application were rejected. So there was a lawsuit filed for the cancellation of the rejection of the application for the medical care benefit. The first trial ruled that the mother and the fetus are single entity, so any damages to the fetus caused by the work during the pregnancy should be regarded as the accident, the occupational accident. And later on, in 2021, if the pregnant worker's fetus health is damaged to the work-related factors, then the occupational accident of the fetus should be recognized and the insurance benefit should be paid. And that law passed the National Assembly. And why this case was recognized? Because there were many different factors, the risk factors affecting the health of the fetus, especially these nurses were involved in the drug grinding work. They were very old patients in the hospital. So these nurses, in order to administer the drug to those patients, without appropriate PPE, those nurses need to grind the FDA category X or FDA category D drugs, even when they're in the 7-month pregnant. So the hazardous, harmful drugs were widely used even when these woman, the nurses were pregnant, and after this grinding work stopped, that the number of the cases where the nurse experienced congenital heart disease for their fetus or the miscarriage, that number has decreased.
So there was this operator. So the child was born in 2004, and so the child had nephropathy and also varicuratal reflex and the renal agenesis. Anyway, the spouse was working in a car assembly work, but was not exposed to chemicals, and so there were no particular past personal history. But in a health checkup, the applicant did have a slightly smaller right kidney. So then if you look at the work history and the pregnancy time, chronologically, anyway, this woman worker was working for about 9 years and then gave birth to the first child, and she had the congenital abnormality, and then later on, the worker shifted to office work. And so then she had the second child in 2007, but the second child was healthy and did not have any congenital diseases. So these cases all underwent epidemiological assessments, and so you can see the summary of the work environment assessment according to the epidemiological investigation. So there was not a lot of proper data at that time, so we were looking at some of the past data nonetheless to see whether the CMR substances were being used. So we found about 10, but then in 2002 and 2004, it seems that the chemicals were not used, but the photo process is similar to a wafer process, and so we were able to deduce that there were many chemicals were being used, but the exposure rate was not very high. It was still quite low. So we don't really have the accurate data, but there was the possibility of the worker being exposed to those chemicals, but the exposure itself was not very severe. And so then based on the epidemiological investigation, the Occupational Disease Reviews Committee would actually make the adjudication. Anyway, according to the committee, the congenital abnormalities come from about 10 to 20% genetic factors and 80 to 90% of environmental factors. And depending on which stage of pregnancy, the reprotoxic substances can affect a variety of substances affect a variety of abnormalities can occur, and they may have been some exposure to CMR substances. And also, since there were lots of substances, there could have been a compounding effect between the different chemicals. And it's also difficult to confirm the relationship between the congenital abnormality and the pregnancy in actual research, because a lot of the miscarriages eventually take place before the birth. And so taking into consideration all of these different limitations, the committee approved the workers' compensation for this worker because it concluded that it was not reasonable to deny work-related illness due to the lack of scientific evidence. The second case is another worker who was working also at this Samsung Electronics for the diffusion process, and the child was suffering from the esophageal atresia and also aplasia of the left kidney. So the worker was working at loading and unloading of the wafer boxes into the equipment. So she was working in the same job. Then in 2006, it was her first pregnancy, which was a miscarried. And then in 2007, she was pregnant again, but then the child had congenital abnormalities. So according to the epidemiological investigation, no chemicals were found to be in direct contact, but there was some exposure to radiation. So the investigation looked into the radiation, and so looking at the material and the actual situation on the ground, the radiation amount was not deemed to be that high. Anyway, once again, the Epidemiological Investigation Committee came to the similar kind of conclusion as well as the Occupational Disease Review Committee, but in the end, this case was approved. The third case was a woman working also in the Samsung Electronics, and the child was suffering from Hirschsprung's disease. Once again, there was not that much exposure to chemicals, but the exposure time was not that prolonged because once she became pregnant, she actually quit her job. But it seemed that the worker may have been exposed to benzene and some other chemicals when she was working at the factory. And so benzene is a well-known neurotoxic substance that readily crosses the placenta, and the Hirschsprung's disease is also does involve the nervous system, and so the review committee concluded that there may have been a close relationship because of the cell movement in the neural crest. The fourth case is a worker who was working with it was actually a male who was working in equipment maintenance engineer at the LCD of the Samsung Electronics, and the child was diagnosed with the charge syndrome. So no chemicals were routinely handled, but nonetheless there was a possibility of an exposure to chemicals. And so there are also research that usually the charge syndrome is genetically handed down through the paternal line. And there are no standards regarding the exposure. And so the committee concluded that this worker will be eligible to get worker compensation. So let me talk about the limitations and significance of this revision of the Occupational or the Workers' Compensation Act to recognize the fetus's industrial accident. The significance is that it's a new topic and it's a new area, but the actual target is rather still limited. So because the paternal line is not recognized still by law, only when the mother has been exposed to occupational hazards will the fetus also be liable for workers' compensation, but not when it's the father's case. So the fetus will also be born, and she will also become a worker in the future, but there is no discussion as yet for the disability compensation benefits nor the survivor's benefits. And also when the child is disabled, the parents do have to take some leave to take better care of the child because the child is disabled, but there is no care leave benefits as yet. So those are some of the issues that we have to work on. So moving forward, we need to go beyond just maternal health, and we have to think about more comprehensively the reproductive health. We also have to think beyond just the issue of the pregnancy and childbirth. We have to be able to address the woman's health issue more broadly, and we have to also go beyond just the father and the mother, in other words, the biological reproduction, towards a more general reproductive health. So we also have to change the way of perspective. So miscarriages have become quite frequent. We now have many women workers who are voicing out the fact that they had a miscarriage as a result of their workplace. We also now have school cooks who are voicing out their concern for lung cancer. A lot of women workers are now really voicing themselves out. But nonetheless, when we see the workers' compensation, we do still see quite a lower percentage of women workers. We have to make sure that women workers are not excluded. We also need more inspectors who are more gender sensitive. So there are many chemicals that are statutorily regulated, but we also need to look at the list to ensure that the list is also quite sensitive to the substances and chemicals that may impact women more. So those are some of the considerations we have to make going forward. Thank you very much.
Thank you very much. Although although we are a little bit of behind the schedule, but still, I wanted to hear more from her because all the cases are very important and they actually cause a lot of social discussion in Korea. So I just wanted to learn more about it. If there is any burning question at this moment, yes. Please pass the microphone, please. Well, thank you. I want to know more. Well, my name is Bae Jin-kyung, and I am from the Korean Women Worker Association. You said that there are less than 100 hazardous substances that affect or that have the reproductive toxicity. So who decided? Who decide which substances have the reproductive toxicity? Well, in Europe, the researches are conducted and then the determination is made by a committee. For Korea, for the occupational health and safety, the hazardous materials or hazardous substances and the hazardous level that need to be done by the research organizations like the Occupational Safety and Health and Safety Research Institution. That's the organization actually controls it. But the list of the hazardous materials or the substances in other countries compared to that, the number of the hazardous substances here is a little bit more limited. Because I studied this part, I want to add a little bit. MSDS, you can refer to that at the workplace. That would be providing the most updated information for the hazardous substance, whether it causes mutation or reproductive toxicity, or whether these are the carcinogen. The Korean law defines them CMR. From the MSDS, you will see the categorization that's under the Korean current law, whether they are managed or not managed. Within the given information, you can check those hazardous substances in the MSD. So you can learn more about that. Is there any other questions?
Yeah, I think we have the professor from the nursing school who. So I had worked in the pharmacy of a hospital at that time. And so the pharmacists in the hospitals were making all the drugs. And so, the nurses at that time were grinding anti-cancer drugs. And also some of the pharmacists were also working. And so the pharmacist will purposely not get pregnant when she has to grind all those really strong drugs. And I had once seen a pharmacist or a nurse who had been involved in grinding had actually purposely had an abortion when she got pregnant because she knew that there would be defects. I remember that period. Any other questions?
Well, when it comes to the terminology, we are using the reproductive health. So for this term, I think if you think about like woman health or woman body, because we're talking about the reproductive health in here, so rather than the reproduction, which is actually in verbatim term translation in Korean, it's better to use reproductive health and reproduction in Korean too. Well, when it comes to Korean language, the reproduction, I thought it would be wider concept than the reproductive health. Well, I'm just talking about this because there are people who say that the woman body is for the reproduction, but I don't want to see that. So that's why I'm saying this. We need to have some discussion on the use of the Korean terminology. So is there any other comments or the questions? If not, there will be a Q&A session afterwards, so we can exchange our ideas and the comments during that time.